Many of you know, of course, Dr. Jeffrey Raval is a facial plastic surgeon. He's located in Cherry Creek North, and his office offers very exciting facial procedures that can give you a new look from one of the few double board certified facial plastic surgeons in the country. Dr. Raval has also been named one of the top facial plastic surgeons in America by the Consumers Research Council of America for the last several years. Very excited to have Dr. Jeffrey Raval back. He's going to talk about a new surgical procedure that he offers to address your aging concerns. It's called a combo lift, and it's based on a better understanding of how we age and how we can improve understanding of cosmetic solutions. And one of his beautiful patients, Pam, is also here. Nice to see you.
Thank you.
So, Dr. Raval, you have a rejuvenation technique. It really helps, and it helps us. We can tell how we look as we age, right?
Yes. So it's kind of a combination, that's why I call it the combo lift. I know, genius, isn't it? Of using the old surgical techniques with some of the newer products that are available, and the combination of the two have really led to a much better result. You know, and it all goes back on our concept of aging. In the past, we always thought that aging was a gravity problem, meaning that as we get older, the effects of gravity takes its toll over time, and things start to sag. So our neck skin starts to sag, our jowling, our cheek tissue starts to sag, and things start to fall. Our brows start to fall as we get older. So everything in the past was aimed at elevating, raising the brows, raising the face, doing a facelift, raising the neck, and the results were good, don't get me wrong, but sometimes if it was overdone, people didn't look natural.
And that's what I was going to ask you about, because sometimes they look like stretched or pulled, and you can obviously tell something's been done.
Right, and so we said, well, they look better, but they just don't look natural. They look plastic, or so, that was the, and almost plastic surgery was getting a bad name or something if it was done too aggressively or too much. You
are such a professional, and I want to give out the phone number right now, 303-381-FACE. That's 303-381-3223, or ravalmd.com to make an appointment. You actually have an example, a patient who had this procedure done.
Yes. So this is Pam. And what we've started to do with the newer technologies, the newer products that are available, is as well as a better understanding of how we age. And that is, not only is gravity a problem, because we still recognize that it's a factor, but we also lose volume as we get older. We started doing some fat injections, finding out that fat didn't last as long. There were some other problems with fat. But there's some new products out there, some newer fillers that really do last a long time. And then we add the complement of Botox or Dysport, which helps reduce wrinkling as well. And when you add those newer products with the older facelift surgery, you get a much nicer, more natural looking result.
And Pam, you're about 4 weeks out from your procedure. What was your concern or your concerns when you went to see Dr. Raval?
Well, pretty much exactly what he said. I felt like it was gravity that was pulling me down, but my cheeks were getting hollow, and my chin was sagging, and my jawline was
well, you look great today.
So that's what I wanted, was the mass lift to take care of all of that.
Yeah, and we did show her before and afters. We didn't talk about, but again, you can see that jawlines improved, necklines improved from the surgery, and then we added the complement of some volume. And then even today, we're going to add the complement of a little bit of Botox.
So this is the next part of the procedure. You're going to do Botox live here in Colorado and Company.
Yes.
And where are you going to add the Botox?
We're going to do some around her eyes, just to reduce some of the wrinkling around her eyes. Again, we don't want it to go away completely, because I think it's a very attractive feature to have some of that, but we're just going to reduce it a little bit.
Okay, let's get started if you don't mind.
And then the other thing I want to just talk about, we actually injected the left side of her face with Botox earlier this morning. So, so for those of you who are concerned or want to know what you could look like immediately after an injection, you can see
look at the camera.
It looks fine.
Yeah.
Really no bruising or anything. It's just.
And that's a big point that we need to make. It's natural looking, because you know I'm a patient of yours, and when I come to see you, that's a big thing. I don't want to look like overdone or stretched, or I've had too much Botox. I want to be able to still frown and have my facial animation.
Correct. So we did half this morning, and then we're going to do this side today. We've already wiped her down. She's already cleaned up.
Are you nervous?
Yes.
No, don't be nervous.
No, I'm not nervous about
Well, and
I'm not nervous about the Botox.
Oh, good. Well, don't be nervous being
Yeah,
on
we did
TV.
this-
I'll
we
screw
did
it
some.
before you do. Trust me. This side of your face has already been done. No bruising. Turn
Correct.
to that side. No bruising at all. You really did a nice job, Dr.
I mean,
Raval.
yes, and you can bruise, but we can just say most of the time you don't. So go ahead and lean back, Pam. And then for those of you who had Botox before, you'll see that the syringe that I'm using is much smaller than you're used to seeing. We use a special syringe in our office with a very small needle, and that also helps decrease the bruising. And this is the Botox that's going in. We're just putting a little bit in. Now, you're not going to see a result from the Botox for a few days. It does take a few days to start working. It actually peaks at about 2 weeks.
And how long does it last?
It lasts about 3 months for most people. It's kind of a bell-shaped curve. Some people it lasts 3 months. That's the average. Some people last 6 months. Some
And if
people
they're
last.
just tuning in and people are like, Botox, does that freeze the muscle? What does that do?
It does weaken the muscle. Our goal is not to paralyze it completely. And there are several products out there. Botox is one, and there's some other competitors out, Dysport, and there's a newer product, Gelman. They all work very well, and we use all of those in our office.
And this is just part of the combo lift that you'll get when you see Dr. Raval 303-381 face. And as you're injecting still and going through what you did for Pam here, in case they're just tuning in, kind of explain, did you do a facelift early on?
Yes.
What were the stages?
So initially what we do, believe it or not, we use the magic of Botox also. So one of the things that we do now is we're injecting a little bit into the neck muscles, and then before the surgery, and then when we do the procedure, we actually sew the muscles here together, and the Botox, and sometimes we use Dysport, helps weaken the muscle here and allows it to stay down and heal a little bit better. And then we did the lift. As you can see in her before and after pictures, we kind of did the lift here. Again, she's about 4 weeks out. As you can see here on the side, you can still see her incisions are a little red. Can you guys see that a little?
Yeah, would you mind turning your head that way just a little bit?
We didn't put any makeup on that today.
That looks really good. Even looking at it, I would not know that was an incision there before.
Yeah. We do, because we do hide it around the ears. You can sit up now,
Yeah,
too.
sorry, here, we'll switch places again.
And then once they've healed, we add some volume around the face. This is some before and afters that we're showing that can show you the real power of the surgical procedure, the facelift, fullness in the neck, jawline. This patient actually had upper and lower eyes done as well as a facelift. And then we gave her filler around her eyes to kind of fill in the volume loss and around her eyes and her cheek. Another patient, again, sagging at the neck. She's also only about 3 weeks out from her procedure. She's coming on the show next month with us and talk about her procedure.
She looks so much younger.
Yeah,
Wow,
doesn't she?
beautiful.
And there's some things like that. That hanging, said actually she's had since she was a child. It was always something.
Hereditary.
So we were able to fix that. So again, take care of something that and make it look better than she ever has with surgical procedures. And then we've added volume on her, and we'll have her on the show again next month.
You do a fantastic job, and Pam, you have to feel good too.
I do
so
feel good. I feel
confidence-wise.
really good about it.
Thank you for coming on the show and allowing us to watch your final procedure. Yeah, if you're interested in talking about your aging concerns when it comes to your face, then please call Dr. Raval's office, 303-381-FACE. That's 303-381-3223. You can also visit ravalmd.com, ravalmd.com, and mention that you saw Dr. Raval right here in Colorado and Company when making your appointment. And when you purchase the combination lift, you'll receive up to 4 filler syringes at 50% off the regular price. That is up to $1,200 in savings. But you got to be sure to call by November 1st to schedule your consultation. For those of you not ready for the combo lift, well, Dr. Raval's office is offering another special. 20 units of Botox or 40 units of Dysport at 30% off, and a full face micro laser peel for $350. Now the normal price, $500, so you are saving. Their number again, it's 303-381-3223. That's 303-381-FACE, or you can go to the website ravalmd.com, and Raval Facial Aesthetics paid for this segment.